no other people that want to venture into rice business or what went wrong.
The competition policy is not a standalone affair, and all players should be taken on board, some members say, while others raise eyebrows about the fees that are levied after the violation of the Competition Act.
Because Gambia is the only country in the whole world whereby if prices go up, they never come down. Once they start going up, it continues going up. They never come down.
The fines are far more than each other according to a layman's view. How are you judging these violations? Because the cause of the violation had not been featured on the report.
Experts say competition regulation is not necessarily price controlled, but depends on interactive market factors.
We are aware that prices have often escalated, especially at ordinary festive occasions, Ramadan, Tuwasti, Christmas, and so on. Prices of rice and some of the major commodities will escalate. And we have been very vigilant. In fact, since 2009, we have been watching it very closely and taking action where it's necessary. But there are interactive factors in the market for basic commodities, one of which is foreign exchange.
The GCC boss also spoke of their recently concluded market study on rice, sugar, and cement distribution, as well as the hard operations and the interventions in the ICT sector for ensuring a level playing field. Other members and subject matter specialists joined the heated debate, which later came to a close with the adoption of the GCC annual activity and financial reports for the year ended December 2012. Samuel Ba, GRTS.
The Gambia Armed Forces informs the general public that the farewell ceremony for departing GAMCOI 17 will be held tomorrow, Friday, 7 February 2014 at 4 p.m. as opposed to the earlier scheduled time of 9 a.m. All are invited to attend. Members of the National Assembly Select Committee on Health, Women, Children, Refugees and Disaster Relief have been touring health installations across the country in a bid to garner first-hand information on the state of the facilities. Babakar Kamara has more on the 6-day fact-finding mission.
We, the Committee on Health, Women, Children, Refugees and Disaster Relief, are embarking on a nationwide tour to go out and see and assess the health situation in the country.
It is an assessment exercise that started late in the North Bank region at Esau Major Health Center, covering Kuntaya and AFPRC General Hospital in Farafenye.
This is actually in two folds, or it could be more than two folds, but the most important ones I would say is, one, we will be able to know what prevails in the health facilities, and two, we will also know, the resources given to the health sector, how is it spent.
The ensuing exercise has brought to bear the increasing inadequacy of oxygen concentrators within the healthcare centers, inadequate professional capacity and staff motivation to respectively respond to major cases of specialization, and maintaining health personnel. This to a greater extent has been underpinned to the limited resource envelope of the Ministry of Health, but a rather passionate drive is being undertaken at the AFPRC General Hospital in Farafenye.
We are lucky to be the host of the major health centers in the whole of North Bank West, which is Esau. Esau is now a major health center, and a lot of money has been pumped there in order for it to be upgraded.
If you go around, you see the changes and also the introduction of new interventions in this hospital. You can see the paintings, new equipments being installed, monitored, and also rehabilitated. One of the things we do for our staff here is they are provided accommodation free of charge. They are provided cash power for their houses free of charge, and their water bills are paid by the hospital. So the only thing they are responsible for themselves is only to feed themselves.
The hospital, according to its administrators, has been able to reduce maternal mortality by 38% within a single year, attracting a vast number of cross-border healthcare seekers from Senegal. The impression, largely noticed by deputies seeing beyond the capacity of an ordinary eye, is yet to generate enough opinion on what should happen next. The auto continues in the Central River region. Babukar Kamara, GRTS.
Saro Women Association is the latest body to receive support from GAIPA, an institution that has been supporting micro-agric initiatives across the country. The package came in the form of taps seeking to make irrigation easy for the women who engage in horticultural activities. Famara Kanyi has more on that story.
Request to reach out to small and medium enterprises as well as support to the National Food Self-Sufficiency Drive. GAIPA has been actively involved in shaping initiatives to improve agro-productivity, in addition helping the horticultural sector. Its latest move in that direction is the presentation of 4 taps to the Saro Women Association. The Saro Women Association has a membership of 245 men and women, and over the years, the body has been actively engaged in vegetable gardening, mainly for household consumption and income generation. Such an endeavor prompted GAIPA to contribute towards economic growth in the country.
These facilities will help them improve their yield per hectare, as well as help them improve the varieties they produce, because most of the varieties that they are cultivating here requires some substantial amount of water, which was a challenge prior to the GAIPA's intervention in this very important activity in the national development and food self-sufficiency programs of this country.
These taps came at a time when the association was in dire need of them. With these 4 taps, the problems faced by the beneficiaries in handling their farm products will ease. This intervention was saluted by the Secretary of the Saro Women's Association, who described the initiative as worthy. This development by the Gambia Investment and Export Promotion Agency, as Abdullah Hydara disclosed, will not stop at this, hinting at other developments in the offing.
Our support will not be limited to this. It's a continuous effort and in continuous collaboration with the private sector, the government, and the Gambian as a whole.
Agriculture remains a fundamental pillar of the Gambian economy, and with a collective approach and commitment on the part of all the players in the sectors, the march towards food self-sufficiency could be realized sooner rather than later. Famara Kani, GRTS News.
Edward Francis Small Teaching Hospital has taken delivery of vital medical equipment. As Rubajan reports, the donation, which is in sync with the request for a robust and more effective healthcare delivery system, could go a long way towards augmenting the hospital's surgical and emergency units.
Medical equipment to the Edward Francis Small Teaching Hospital, according to officials, comes at a time when the hospital is on the verge of expanding, especially in its surgical and emergency services. The items, which include a theater operating table, anesthetic machine, portable X-ray machine, electric and manual suction machines, among other crucial items, according to Dr. Samate, will greatly improve service delivery in the surgery and emergency units.
We have here donated very critical equipment, anesthetic machines, scanning machines, operating table for the theater, and as we have heard from the CMD, the Edward Francis Small Teaching Hospital is in the verge of expanding, having new theaters, so these are critical equipment that are required.
Sometimes we get mortalities just because we do not have these machines. We have a beautiful surgery, patient is sent to the ward, no suction machine, so even if they aspirate, nothing can be done. What we did was, we ran through all the wards to find out which one has a functional suction machine for us to be able to, so this is a wonderful machine. Now, the portable X-ray machine, what that means is that we can do X-rays on the spot. We can do them at the emergency room when patients come in with severe injuries. We can do chest X-rays there. We can do abdominal X-rays there. So if there are injuries, we can identify them on the spot and take immediate action. So that saves a whole lot of lives too.
The health sector continues to be among government's top priority areas of intervention, thus continue to receive significant boosts from both government and its development partners. And this latest support given to the hospital, according to the Chief Medical Director, Dr. Amal Jafari, will in no small measure help in improving healthcare service delivery.
On behalf of Edward Francis Small Teaching Hospital, all staff, and on my behalf, I wish to thank Honorable Minister, and I wish to thank Dr. Tal, Permanent Secretary and Chief Pharmacist for this donation. And we always work